Hey guys, welcome back to my YouTube channel. Today we are going over the toxic lady, toxic woman. Her real name is Gloria Ramirez. If you've heard of this case, you might learn a little bit more. I've known a lot about this. I've known it for a long time as well. But we're gonna go over it. I find this case super interesting. And yeah. Don't subscribe just yet. I will earn your subscription by the end of this video, and don't leave a like just yet. Watch the video all the way through, and then once you get to the end and you actually like the video, make sure to leave a like. It really helps me out that you want to see more just like this. And alright, enough talking, let's get right into it. We need to talk about Gloria Ramirez, or also known as the Toxic Lady. No, she's not toxic, like a relationship thing. We are literally talking about toxic, like poison, almost. Let's start from the beginning. Gloria Cecilia Ramirez, I'm so sorry if I got that wrong, was an American woman born on January 11th, 1963 at Riverside, California. She would later in life be dubbed as a toxic lady and or woman, however you want to call her, by the media when several hospital workers became ill after airborne exposure to her body and blood. Gloria would be admitted into the emergency room because she was suffering from late-stage cervical cancer. When hospital workers were treating her, 3 of the hospital workers would faint. Others would experience shortness of breath and even muscle spasms. 5 of the workers required hospitalization. One of the workers would have to stay in an intensive care unit for 2 weeks. Gloria would pass away from complications that were related to her cancer shortly after she arrived at the hospital. This incident would initially be considered as a mass hysteria case. An investigation by Lawrence Livermore National Laboratory would suggest that Gloria had self-administered DMSO, which I'll put right here, as a pain treatment. DMSO can cause contaminants, toxins, and medicines to be absorbed through the skin, which may cause unexpected effects. DMSO is thought to be increase the effects of blood thinners, steroids, heart medicines, sedatives, and other drugs. In some cases like this, it could be harmful or even dangerous. Oxygen from the mask that had been provided by the paramedics during her transport to the hospital could have likely converted the DMSO into DMS, which I'll also put on the side, which is a highly toxic and carcinogenic alkylating agent. I'm so sorry if I get any of this wrong, it's difficult. DMS is carcinogenic, mutagenic, highly poisonous, corrosive, and environmentally hazardous, so it's pretty damn bad. It is absorbed through the skin, mucous membranes, and gastrointestinal tract, and can cause a fatal delayed respiratory tract reaction. Although DMS has a very low vapor pressure at the body temperature, it's believed to have transitioned into a gaseous state due to the vacuum inside of the vacutainer. And it's similar to how water boils at a lower temperature when exposed to low pressure. This theory has also been endorsed by the Riverside Coroner's Office and has been published in the journal Forensic Science International. Now let's really get into everything in full detail. That was just a go over for what could have happened. But now let's really get into the details of everything. Prior to arriving at the emergency room, Gloria's boyfriend, Johnny Estrada, would call 911 and report that Gloria had been experiencing nausea and vomiting throughout the entire day. Around 8:15 p.m. on February 19, 1994, Gloria would suffer from heart palpitations and would be brought to the emergency room of Riverside General Hospital in Riverside, California by the paramedics. It had been obvious that she had been extremely confused, but not only this. She was also suffering from tachycardia and Cheyne-Stokes respiration. I'm so sorry, okay? Medical terms are difficult. Maureen Welch, who had been a respiratory therapist, would know Gloria's age and would state that even though she had cervical cancer, most patients that were exhibiting her symptoms were elderly. The hospital staff would administer diazepam, midazolam, and also lorazepam to sedate Gloria, and they would also follow up with the lidocaine and beryllium agents to address her abnormal heart rate. I'm sorry. When it became clear that she had been responding poorly to the treatment, Gloria would suddenly go into shock. Staff would try to defibrillate her heart. At this point, several of the medical workers would see an oily sheen starting to cover Gloria's body, and would also notice a fruity garlic-like odor that they thought had been coming from her mouth. Susan Kane, who had been a registered nurse, would draw blood from Gloria's arm and would notice a ammonia-like smell coming from the tube. Kane would ultimately pass this tube to medical resident Julie, not even gonna try that name, I'm sorry, who would notice manila color, which is yellow-brown, crystallized particles that were floating around in her blood. At this time, Kane would begin to feel a burning sensation on her face and would faint. And she would be removed from the emergency room. Shortly thereafter, Julie would begin to feel nauseous. She started complaining that she felt lightheaded, and she would leave the emergency room and sat at a nurse's desk. And seeing this, a staff member, seeing Julie like this, would go out to her and ask if she was okay. But before Julie could even respond to this question, she would faint. Maureen would be the third person to faint. After noting the blood drawn smelled less like that from a chemo patient, more like ammonia odor the other staff had been describing. On awakening, she could not control the movements of her limbs. I'd be so terrified of that. After these three had fainted, staff had been ordered to evacuate all emergency room patients to the parking lot outside of the hospital while it was declared under an internal emergency. During this time, a skeleton crew would stay behind to stabilize Gloria. Why are they called skeleton? The skeleton crew? Why? 8:50 p.m. 45 minutes of CPR defibrillation. Gloria had been pronounced dead from kidney failure that was related to her cancer. 23 people that were in her vicinity became ill, and 5 of those had to be hospitalized. They required it. The incident itself was around 30 minutes, with Gloria's body being isolated into a separate room next to the trauma room and would later be bagged and moved into an airtight container. Now, this is the part where we dive into the entire investigation around what exactly happened. The Riverside County Health Specialist Department would call on California's Department of Health and Human Services, which put 2 scientists, Anna Marie Osorio and Kristen Waller, on the case. They would interview 34 staff members who were working in the emergency room on February 19th. Using a standardized questionnaire, both of the scientists would find out that people who had developed severe symptoms, such as loss of consciousness, shortness of breath, and muscle spasms, tended to have certain things in common with one another. People who had been working within 2 feet of Gloria had handled her intravenous lines would have been at a higher risk of whatever had happened. Other factors that correlated with severe symptoms had not appeared to match a scenario in which fumes had been released. The survey found out that those who had been affected the most were women rather than men, and they would have normal blood tests after the exposure. Now, these two scientists believed the hospital workers suffered from mass hysteria. In total, 27 of the 37 staff members in the emergency room that night would report feeling some type of symptom. Hearing this, Julie would deny that she had been affected by mass hysteria and would point to her own medical history as evidence. After Julie had been exposed, she would spend the next 2 weeks in the extensive care unit with breathing problems. She had developed hepatitis and an avascular necrosis in her knees. The coroner's office in Riverside would contact Lawrence Livermore National Laboratory to investigate the incident. Livermore postulated that Gloria had been using DMSO, a solvent most commonly used as a degreaser as a home remedy for pain. People that use DMSO will report it having a garlic-like taste. It's sold in gel form from hardware stores. Topical application to Gloria's skin could explain the hospital workers seeing her skin almost oily and shiny. Livermore would theorize that the DMSO in Gloria's system could have built up owing to urinary blockage caused by her kidney failure. Oxygen that had been administered by the paramedics would have combined with the DMSO to form DMSO2, and it is known to crystallize at room temperature, and crystals had been seen in some of Gloria's drawn blood. Electric shocks that were administered during emergency defibrillation could have then converted the DMSO2 to DMSO4. So there's a lot of DMSOs and DMS shits. But we'll get into it. However, many organic chemists turned this theory down, citing the length of time required for a reaction like this to occur and uncooperative variables within Gloria's body in making this conversion. This case was one of the most extensive investigations in medical history. In the end, it has been suggested that the hospital staff underwent an outbreak of a mass sociogenic illness, which could have been a result of the chemical conversion. Now, about 2 months after Gloria had passed away, her body would be released for an independent autopsy and burial. The Riverside Coroner's Office would hail Livermore's DMSO conclusion as a probable cause of the hospital staff's symptoms. But Gloria's family would not have this. They would disagree with this. And her sister, Maggie Ramirez Grace, would speak out in April of 1994, inquiring into the 10 weeks it took for the cause of death to be deemed natural causes. Maggie furthered this point by arguing that her sister wouldn't have died that night if she didn't go to the hospital. Kinda strange. Dr. Richard Fukumoto, the family's pathologist, had been unable to examine her body upon its release. Due to a large set of strange circumstances, some of Gloria's organs were cross-contaminated with fecal matter. Her remains were also heavily decomposed by the time Dr. Fukumoto could examine them, and strangely, her heart was missing. These findings would only lead to further doubts by the family about the standard of care maintained at the hospital and by the county coroner. As along with her heart, the vial of blood taken prior to Gloria's death could not be located. 10 weeks after Gloria Ramirez's death, on April 20th, 1994, she would finally be buried at Olivewood Memorial Park in Riverside. Her official case of death would be written off as a cardiac dysrhythmia that resulted in kidney failure, which all stems from her cervical cancer. During and after her funeral, her family still continued to point the blame on the poor care of the hospital for Gloria's death. And they still maintain that the toxic fumes that resulted in her death, along with the hysteria, could have been attributed to the hospital. There could possibly be a cause for this incident by Patrick M. Grant of the Livermore Forensic Science Center would appear in some forensic science textbooks. In one of these textbooks, Fundamentals of Forensic Science, the authors state that although the hypothesized conversion of DMSO2 to DMSO4 has not previously been observed, the postulated scenario is the most scientific explanation to date, and that, beyond this theory, no credible explanation has ever been offered for the strange case of Gloria Ramirez. Grant's conclusions and speculations about the incident would be evaluated by professional forensic scientists, chemists, and toxicologists, and it would pass peer review in an accredited referred journal. It would ultimately be published by Forensic Science International. And that's it. We talked about Gloria Ramirez. Very, very weird case. We've never really looked into spontaneous human combustion or anything like this. So this is so strange. Such a strange case. And that was a little hint right there. If you caught that hint, I'm proud of you. Unless you're watching in the future, then yeah, I'm still proud of you. Anyway, what do you think about this case? It is super interesting. What do you think may have caused her death? And you can put that in the comments down below. And yeah, if you want to reach out to me anywhere, these are my socials. They are also in the description down below. You can text me there. And yeah, if you actually enjoyed this video and you want to see more just like this, make sure to leave a like. And if I earned your subscription, make sure to subscribe. It really helps me out. We are so close to 100 subscribers. We are trying to hit 100 before August. And I have a very, very special video coming out when we hit 100 subscribers. And it's for the YouTube channel. It's not just a random video of me twerking. Someone's gonna ask for that now. Anyway, with that being said, I hope you guys enjoyed this video. I know it's a little bit rushed, and I'm very sorry. I will catch you guys in my next video.